politics rather than science-led policies. The commercialization of marijuana disguised as medicine is also negatively impacting sound drug policy globally. Our aim is to create a global policy conversation that focuses on science, public health, workplace safety, and human rights, while avoiding policies that have proven ineffective and harmful. In the United States, it has caused significant negative consequences for employers who wish to be a drug-free workplace, and it has also resulted in many employers no longer testing for marijuana. This has resulted in increased post-accident incidents and ultimately made the workplace less safe. These state governmental commercialized policies permitting the use of marijuana for medical purposes have created, without any specific scientific support, in fact, when the term "follow the science" is used in other public policy deliberations, the exact opposite approach is used when developing marijuana public policy. Politics and money take precedence over science. The harmful effects of marijuana and its adverse effects on the general population and the public safety are totally disregarded. Let us not forget that science and regulatory policies protect the individual. Commercialized policies protect the manufacturers and those who have a financial interest. The result has been that the marijuana industry's influence on public policy has greatly increased in the United States in the last 5 years. As an example, in 2011, the marijuana industry spent only around $35,000 to lobby elected officials, while the most recent expenditure reports show that cannabis interests in 2024 spent over $3 million to lobby federal government officials, with state interests exceeding even those numbers combined. And in 2025, the marijuana industry spent over $100 million to change a state's constitution to allow recreational marijuana. However, this effort was ultimately defeated by the voters. The U.S. experience reveals pronounced lobbying activity and political financing by the cannabis interests, raising concerns about the creation of public policy and market access over the public good. Regulatory promises such as significant tax revenue, job creation, have not materialized, complicating the narrative that liberalization is beneficial and in the public's interest. The United States presents a clarifying case: comprehensive state-level reforms legalizing marijuana with a commercialized approach has not delivered the promised public health or safety outcomes the public is entitled to from its government. Global policy should not blindly imitate a liberalization model that lacks consistent regulatory guidance, uniform data, and rigorous safeguards. Instead, we must pursue policies rooted in independent science, transparent governance, and continuous evaluation. I appreciate your attention, and I look forward to the opportunity to discuss this important issue with you further. Thank you, Madam Chair.